So we do not have updated models this week, but we continue to monitor the unfolding of the pandemic around the world. Areas of course, ongoing interest are the approach to zero COVID in China, which continues. Officially reported cases are actually not increasing and are maybe coming down, but stringent mandates are in place in many locations. From experience in other countries, we do expect at some point that Omicron will spread widely in China, but it is very much a question of when the government decides to stop pursuing this zero COVID strategy. Elsewhere in the world, we're seeing increases. The BA4, BA5 related and winter related increase in South Africa continues. It is certainly not as exponential as the original Omicron wave, but does continue to increase with some indication that it may be reaching a peak. In the United States, Omicron continues to increase in a number of states. And that increase, again, seems to be like what we've observed in many countries in Europe related to behavioral relaxation and possibly BA2 reinfection of people that have had a prior Omicron infection. Although it's perhaps easiest to account through the behavioral change. In neither case, neither what we saw in Europe nor what we're so far seeing in the United States are we seeing an increase in death, which is very good news. That's likely because there is either vaccine-derived or infection-acquired immunity, so that people aren't fully immunologically naive, and perhaps because of the increased use of antivirals when individuals do become sick, which should have a marked effect on the death rate. So we don't, at this point, think there's reason for large-scale concern, and also do not expect, with few exceptions, that there will be implementation of mandates in these jurisdictions outside of the zero COVID strategy in China. Of course, one of the critical factors that do go into the longer range modeling and even the short range is the extent to which Omicron infection provides protection against subsequent new variants or even subvariants of Omicron. And there was a paper in Nature this week, which is a lab-based paper based on the immune responses from sera from different types of patients that suggested that there might be limited cross-variant protection from Omicron infection. Given we'll really want to wait and see when studies are able to start reporting from actual infection in individuals what sort of cross-variant immunity there is. If you remember, both for vaccine-derived immunity and infection-acquired immunity, the available studies suggest much lower protection against Omicron infection, pretty good protection against severe disease and death, but greatly reduced for infection. And we'll have to wait to see whether that difference holds true for Omicron on Omicron by subvariant or even future variants, namely less protection against infection, but hopefully more protection against severe disease and death. But of course, that issue will have a profound effect on what the fall and winter may look like, as we do expect waning immunity both from vaccines and infection-acquired immunity, plus indoor exposure and opportunities for transmission, that there should be increased transmission potential November, December, January, and the extent to which there is long-range protection for severe disease and death will have a marked effect on outcomes.